As a sleep provider, I see restless leg syndrome frequently. It is also something that I have struggled with, and did you know that globally it is thought to affect 5 to 10% of the population? That's a lot of people with restless leg syndrome. A question I get asked frequently is, are there any lifestyle modifications or natural supplements and treatments for restless leg syndrome that don't involve prescribed medications? In today's video, I'm going to be breaking down some natural treatment options for RLS. Now, in future videos, I will dive into medical prescribed therapies and medications for RLS, but today it's all natural and lifestyle changes. Now, restless leg syndrome, if you don't know, or RLS, is a neurological disorder characterized by an irresistible urge to move the legs and sometimes the arms at rest. It's often accompanied by uncomfortable sensations such as itching, tingling, or crawling. Now, the biggest one though is urge to move at rest and at nighttime. While the exact cause is unknown, it's believed to be related to abnormalities in dopamine levels in the brain. There are other secondary causes that I will break down in future videos that may be reversible, such as medication side effects, nutritional deficiencies. So make sure you subscribe for those future videos. And if you find today's video helpful, please give it a thumbs up. Now, let's break down the 6 lifestyle modifications for RLS. Let's start with number 1, limit caffeine. Limiting or avoiding caffeine, especially in the evening, can help reduce the frequency and severity of RLS symptoms. Stimulants and caffeine can disrupt sleep patterns and exacerbate symptoms of RLS, especially if taken later in the day or towards the evening. Caffeine, found in things like coffee, green tea, dark chocolate, and those energy drinks that you buy over the counter at the grocery store, are likely to increase the nervous system arousal and therefore also increase heart rate, blood pressure, and symptoms of anxiety. The excessive caffeine close to bedtime will likely disrupt your sleep cycle and increase the risk of insomnia, and in studies has shown to worsen restless leg syndrome. Cut out caffeinated beverages, ideally 9 to 10 hours before bedtime. And if you continue to have severe RLS symptoms, consider cutting out caffeine completely for a few weeks to see if symptoms improve. Number 2 is replete iron stores. Iron deficiency is the number 1 reversible cause of restless leg syndrome. It's easy to test for. You need a simple blood test or an iron panel ordered from a primary care provider or a healthcare provider. Consuming iron-rich foods, if you're deficient, such as lean meats, leafy greens, beans, and fortified cereals, can help replenish those iron stores and alleviate symptoms. By ensuring adequate iron intake through diet or, if needed, supplementation, you can improve iron levels in your body and reduce the severity of RLS symptoms. Again, this is saying if you are deficient in iron to begin with. You can also watch my previous video about the 7 vitamins that you may be deficient in that could be worsening RLS symptoms, and I'll link to that in the description. Number 3 is exercise. Most people with RLS should aim for at least 30 to 60 minutes of moderate exercise every single day. Avoid areas where your joints hurt, as this could make your restless leg symptoms worse. But you want to engage in regular physical activity. This could be walking, swimming, or cycling. These all can help alleviate symptoms of RLS by promoting better circulation and reducing stress. We also know that people who exercise daily do sleep better in studies. Exercise not only helps tire the muscles, making them less prone to restless movements at night, but it also releases endorphins, which can improve mood and promote relaxation. This does not mean overdo it though. Start low and go slow when you're first starting out or if you haven't been active in a while. Number 4 is sleep hygiene. Establishing a relaxing bedtime can signal to your body that it's time to wind down and prepare for sleep. This can include activities such as taking a warm bath, relaxation techniques, yoga, or even just reading a book and settling down, creating a comfortable sleep environment. You also want to make sure that you're going to bed and waking up at the same time each day, even on the weekends. By incorporating calming activities and a routine into your evening, you can promote relaxation, reduce stress, and make it easier to fall asleep and stay asleep throughout the night, as your circadian rhythm will be in sync. Number 5 is dietary changes. Certain foods and beverages may worsen symptoms of RLS. Avoiding or at least limiting intake of processed foods, sugary snacks, and high fructose corn syrup, especially before bedtime, can help reduce inflammation and promote better sleep. Studies have shown that the risk of restless leg syndrome does increase with weight gain, diabetes, and a diet high in fructose corn syrup and processed foods. By making mindful choices about what you eat and drink, you can support not only your overall health, but minimize disruptions to your sleep and hopefully reduce your symptoms of RLS. Number 6 is compression therapy. Wearing compression stockings or compression sleeves during the day may help improve circulation, reduce edema, or that swelling that people get in the lower legs and extremities. It is also thought to reduce nighttime symptoms of RLS. Compression socks are thought to also be useful in associated disorders such as peripheral vascular disease, chronic edema, which is again that fluid retention in the lower legs, patients with heart failure who end up with edema, and overall are thought to improve circulation throughout the day. Wearing these throughout your daytime work or whatever you're doing may also help with those nighttime symptoms of RLS. But always talk to your provider before you wear compression stockings if you have an underlying health condition. And again, I will link in the description to the compression socks that I wear on a day-to-day basis. Restless leg syndrome can be a challenging condition, but with a combination of lifestyle changes and treatment options, relief can be possible for some people. Whether it's avoiding stimulants or caffeine, repleting iron stores, exercising regularly, practicing good sleep hygiene, or even wearing compression socks, there are treatment options that are more natural and holistic that you can employ in your day to day life. Ultimately, though, if you continue to have limiting symptoms that are affecting your sleep, causing insomnia, making you feel like garbage the next day, you need to talk to a healthcare provider. There are other tests like sleep apnea testing, as well as other treatment options like medications that may make your restless leg symptoms more bearable and tolerable. Now, if you found this video helpful, please give it a thumbs up. If you found this content and you want to hear more content from me, or if you want to see future RLS videos or even just sleep tip videos, please subscribe. Thank you everyone for joining me today. I hope everybody has a great night.